Hi, my name is Randy Cox. I'm a stage 4 colon cancer patient. I was diagnosed about a little over a year and a half ago with stage 4 cancer. I had my primary tumor removed because it was blocking my colon. And since April Fool's Day of last year, I've been receiving chemotherapy every other week. I was at my doctor's for a routine checkup. We noticed that I had a pain when he pressed in parts of my abdomen. He thought there was something suspicious about that. He scheduled me for a CAT scan that day, and I had a CAT scan. And the next day I had to leave town with my son to look at a college. And I came back the following Monday, and the day after that, I had almost an emergency sigmoidoscopy. They saw a big growth in my colon, and the next day my doctor called me and asked me to come to his office at 4:30 and to bring my wife. I thought it was just something. I didn't know what it was. When I got to the office, and my wife was there. We sat down with the doctor, and he told me I had stage 4 colon cancer. It was pretty devastating. But 2 weeks later, I had surgery to remove the primary tumor because it was blocking my colon. And since then, I've been on chemotherapy every other week with an angiogenesis drug, an anti-angiogenesis drug, and I'm in pretty good health otherwise. If I didn't have cancer, I'd be perfectly healthy. It's a wild world out there, and patients need to be aware. They need to understand what their diagnosis is. They need to understand what treatment options are available to them, and they need to participate actively, intellectually, and emotionally in making the decisions which are of what care is best for them. Not only medical care, but looking for your support group. Having a good support network is really important. And seeing whatever health professionals you can see that will help you. There's hope. It's amazing. With the current chemotherapy drugs that are out there, especially for colon cancer, there's a lot of hope. There are lots of different options out there, and don't worry about the side effects. There are great, wonderful medicines that will minimize side effects. So cancer's not like what it was 20 years ago. Today, there were a number of things that people talked about. One of the things that I'd heard before, but I hadn't quite thought about it much, which is that we all have cancer cells in us, but they are dormant, and it's the active cancer cells that we need to worry about, not the dormant ones. So if we can make our cancer dormant, it's just as good as getting rid of it.